Health matters now as the nationwide strike embarked by the National Association of Resident Doctors enters day 3. Medical services in Zamfara state have been paralyzed. The doctors' body in the state says the strike has negatively affected clinical services as patients, including victims of bandit attacks, have been left unattended to. Chairman of the chapter in Federal Medical Center Gusau says there's no going back on the strike until their demands are met. Theophilus Darifai reports.
The Federal Medical Center Gusau, which used to be a beehive of activities, is now nearly empty due to the ongoing nationwide strike embarked upon by the National Association of Resident Doctors. The doctors again decided to down tools due to the failure of the federal government to implement the agreement reached last April over their welfare. Their demands include increment in hazard allowance, medical residency training funds, salary shortfall, and the non-payment of salaries to some members. The president of the doctors' body in Zamfara appeals to the federal government to act fast as patients, including victims of bandits' attack, are in their need of medical attention.
This is a very wrong thing for government to do, especially during this time that we have a lot of challenges. For example, in North West, that we have so serious security challenges. I think government need to step on their toes, let them do needful. I think this strike is supposed to be called upon because, as far as I'm concerned, government can do something within the next 24 hours.
He says many qualified doctors are leaving the country due to lack of improved welfare.
We are calling upon government, let them do something. These house officers that they are seeing is either they took them very serious or there should be migration from this country to another country. So we are telling the government we can see a danger sign. Imagine, even as we are talking, our president is not in this country. He traveled abroad and forward for medical health care.
Authorities of the hospital says measures are in place to continue skeleton services. Dr. Sunday Onazi says only emergency cases are being attended to.
The doctors who are at the level of directory cadres are there, and we also have NYC doctors. And then if somebody has emergency, he will just be resuscitated, stabilized, and referred to another hospital.
He appeals to the federal government to, as a matter of urgency, settle the issue to enable doctors to resume work as patients are going through hard times. This is the second time in 7 months that the National Association of Resident Doctors are going on strike over the same demands. They are worried that this strike is coming when President Muhammadu Buhari is again outside the country for medical checkup and other official engagements, just as it happened last April. Theophilus Darifai, TVC News, Gusau.